University Dental Hygiene Program, and I'm Zoe. This is Nicole right here, and this is Shannon. And we're here to teach you proper techniques it takes to maintain an oral mouth, like a healthy oral mouth for your patients here at Lakebridge. Good oral health is vital for everyone because you are speaking, eating, chewing, doing everything with your mouth, so you want to be sure that all your patients receive daily oral care on a daily basis. As you know, many older patients, they're sensitive to touch or anybody around their mouth. They don't want anybody touching it. So whenever you do, however, get around that area, cleaning their mouth, be really, really soft-spoken, friendly to them. Don't move so fast when you're talking to them. When you're in their mouth, explain everything you're doing. Like hey, I'm going to get in your mouth. I just want to show you, this is here. This is what I'm looking for. That's what you want to speak to them about. It may be difficult and a struggle. Be patient with them. You're doing them a great service. You're doing a great service in general, but doing that for them is just helpful. Some daily oral care instructions. Some of your patients will have natural teeth. You want to remove any bacteria, biofilm from their teeth when they eat and drink, debris that gets on their tongue. So what you're going to do is take, not this big huge brush, but a normal size brush with soft bristles, and you're going to angle your toothbrush when you're brushing their toothbrush to the gum line, and then sweep down in a sweeping motion towards the tongue. So you're going to do so. Don't try and go back and forth like this. That's going to irritate their gums. And also remember to brush their tongue, not with a toothbrush, but with a tongue scraper. And what this is you're going to put it in your mouth, or their mouth, and brush towards you. So if the patient's sitting here, you're going to go like this, towards myself. Not go back and forth. That'll irritate the tongue. Flossing, you're going to get in between their teeth with a flosser. These two options right here are your best choices. The plucker or a clacker. That is you're going to be able to use with one hand in between your teeth. This right here is just a flossing handle stick. So basically you take the floss, you wrap it around this little nozzle right here. It's really not this difficult, but this long piece of string. So you put it right here. It goes in between there. If I can get it on there, perfect. And back around, and that'll be easy for you to get in their mouth, so you don't have to use two hands to get between their teeth. You can just use one and go in between there. And also I brought with me, if your patients do, have dexterity and they can, brush their teeth without you brushing their teeth, this is an option right here. You have a tennis ball, cut a hole through it, put their toothbrush, and they can hold it themselves and clean their own mouth. Also, a roller, just imagine this is a roller. You can take your toothbrush or their toothbrush, put the roller on it, and tape it together, and it can be a longer stick for them to use, so they can get in there without even having a really big toothbrush and their hands are too big. But now that I've explained some oral hygiene techniques to you, Nicole right here is going to explain how to remove a denture properly and how to cleanse it.
Okay. Do most of the patients here wear dentures?
Yeah.
Would you say that they wear them all day long?
Yeah.
When do they take them out?
At night.
At night. Okay. Are they sitting on the counter or in water?
In water.
Okay, that's great. I'm sure that you all have been shown how to remove dentures properly, but just for a little review, you'll want to wash your hands, put on gloves, and you can grab a gauze, and you'll want to start with the bottom denture just because it's a little bit easier to remove. And you'll just take your finger and your thumb with the gauze and just take the bottom and just kind of do like a little rocking motion and just take it out, and it should come out fairly easy. And then you're going to move on to the top. Oh, when you take it out, you want to put it in a glass of water. And then when you go to take out the top, it's a little bit harder to remove because of the suction. So you'll just get your dry gauze again and grab the front here, and then with your other hand lift up the top lip and just kind of pull upward and outward kind of toward the nose, and that should break the suction. And once the suction is broken, you'll want to move the sheet to the side and kind of tilt the denture a little bit and pull it out that way. And place that in the cup with the water as well. And then after the denture is removed, you want to go ahead and clean out the oral cavity. You can get a wet gauze or a wet washcloth, and you just wipe over the roof of the mouth, the sides of the cheek, and down on the bottom where the lower denture sits, because patients can have food stuck on there and not realize it, and it can cause irritation. So now that you clean out the oral cavity, you're going to go over to the sink to clean the denture, and you don't just want to rinse it off. It really needs to be brushed because some food debris and plaque can stay in the crevices, and you don't have to do the same brushing motion that Zoe showed you with the sweeping because you're not going to hurt gums. But you can just take it, and they have denture brushes that are a little more pointed and tucked in, or you can use a soft bristle toothbrush and just wet it and the denture and just kind of brush across it just to get all the debris off on all sides. And then turn it over, and like where the little suction part is, where it sits onto their ridge or their gums, it has like a little indentation, so you'll want to just get in there and wipe that out really good. Pop it in the cup, and they can sit there overnight.
So rude right now.
I'm such a rude dude.
We're trying to learn how to brush teeth here.
So you can just place the denture in the cup, and if you have a little denture cleaner tab laying around, you can pop it in there, but if not, just putting it in water is fine. A few things to remember, don't let the denture sit out on the counter and dry out, it will change the shape of it, and using hot water will do the same thing. And now that I've talked to you about how to clean the denture and how to remove it, Shannon will briefly explain oral screenings with you all.
Okay. In the little packet that I gave you all, there's a handout on how to do a comprehensive oral exam. It's from a magazine article. So I'll just kind of go over why we want to give exams. We do oral screenings on our patients every time they come to see us, so twice a year. So I would, recommend that to you all if you have time. Twice a year, just kind of do a quick assessment of the mouth. Anybody can really do it, and it's effortless, really. Your eyes and your hands are going to be your best tool, and lighting. You really need good lighting to get in there and see everything. And I've listed on the brochure 4 things that are very, very common in the elderly mouth. And the first one I'm sure you've heard of is candidiasis, or also known as thrush. It's just an overgrowth of yeast in the mouth. And is it going through?
Yeah, it's not going.
Oh, it's okay, my phone's going.
Your phone's going? Okay.
Candidiasis, like the rest, can be caused by chemotherapy or dentures or just dry mouth. And then the next one I want to talk about is denture stomatitis. It's a form of thrush, and it's just confined to the area where the denture rests, and it looks red and white. So if you do see this, you just want to note it down and refer it, to a dentist if you all have one that comes in and does an assessment. And then the next one I want to talk about is dry mouth, or xerostomia is what it's called. That's a side effect of many, many medications, so I'm sure you all see that a lot. There are some things available to treat that. There's products called Biotine that just kind of coat the oral mucosa in the mouth, just make it feel better. Water's not really going to do anything because as soon as it's swallowed, the effect of it's gone. The next one I want to talk about is angular cheilitis. It appears as like dry skin folds on the sides of the lips. It's really noticeable. And it's also caused by candidiasis or a vitamin B deficiency. So again, if you see something like that, just note it. All of those things have to be treated, except for dry mouth, with an antifungal medication, which would need to be prescribed by a dentist or doctor. So it's just something to look for. Also on this, we have the number for our clinic. If you know anybody that wants to get their teeth cleaned or anything like that, we always need patients. So there's our number. I would like to show you an oral screening that we do. But if you all don't have time, just look at this sheet and read through it. It's got some really good pictures in there about how to just manipulate the tissue and really look at everything. And I'll just go over what's in your packet real quick that we gave you. You should have a brochure that we made for all the information we talked about, and the number to our clinic, a Listerine coupon, a pamphlet on dry mouth. This is a really good thing. If you're not familiar with dry mouth, it's a really good thing to read. We printed off 4 oral health fact sheets, one on brushing, one on flossing, one on denture care, and one on oral cancer. And then there's 2 handouts from a geriatric dentist in this area, Dr. Huffine. And these are really good that he's typed up. One's on denture adhesives and one's on dry mouth and dentures. And then this is one from one of our textbooks on how to remove an upper and lower denture. It's really good instructions. And then, of course, I already showed you this, the oral screening article. Do you have any questions or anything like that?
Any concerns about oral health?
Thank you so much for coming to see us. We really do appreciate it and taking out your time today.
Thank you all so much for coming.
Thank you all.